The David Pakman Show at davidpakman.com.
Most of the funding for the David Pakman Show comes from individual memberships like the one you can subscribe to at davidpakman.com/membership. You know, we now have expanded to 4 shows per week. We're putting out 4 hours and then some with some extra YouTube content that we do of completely free content. And, you know, for really what most people blow on coffee, Lewis, you can go a long way with the membership supporting the show. You'll get access to the extra bonus show, which is for members only, both audio and video, as well as a huge archive of our programming that dates back to the very beginning. Most of the time, Lewis, for free, we have our last 10 episodes available, but hundreds and hundreds of episodes available for David Pakman Show members. Quite remarkable.
Yep, enough David Pakman to keep you occupied for months, maybe even years.
Oh, I would say years.
Yeah.
Yeah, for the average person, for sure.
That's a lot of DP.
Breaking news. This might come as a surprise, Lewis, but Congress has passed socialized medicine and mandated health insurance at the federal level. The reason you may not be hearing about it is it happened in 1798. This was when we saw the latest healthcare reform bill from President Obama. The ink was barely dry, and we already saw lawsuits, and now it's been brought all the way up to the Supreme Court, and hopefully in June we'll be hearing what the results are. It turns out that the Founding Fathers would disagree with the legitimacy of those lawsuits. In July of 1798, Congress passed, and John Adams signed, an act for the relief of sick and disabled seamen. The law authorized, this is unbelievable, Lewis. If people knew about this, you know how people always say the Founding Fathers would be turning over in their grave? It turns out they actually wouldn't. It turns out they would agree with having a more government-supported and funded healthcare system.
They're constantly turning in their graves because they are constantly being misquoted, misinterpreted, and I don't know.
Used for political gain.
Used for political gain. People just create their own platform and then state that the Founding Fathers, that's what they believed in.
The July 1798 law authorized the creation of a government-operated marine hospital service and mandated that privately employed sailors be required to purchase health care insurance. Keep in mind that the Fifth Congress did not really need to struggle over the intentions of the drafters of the Constitution because many of its members were the drafters of the Constitution. Mm-hmm. And when the bill came to the desk of President John Adams for a signature, it's safe to assume he had a pretty good grasp of what the framers probably had in mind.
I would say so, yeah.
And during the early years of the Union, the nation's leaders realized that foreign trade would be essential to the young country's ability to create a viable economy. To make it work, they relied on private merchant ships and the sailors that made them go to be the instruments of the trade. Private industry, Lewis. Private. The problem was that this was a difficult job, it was a dangerous job, and people were constantly getting hurt, picking up bizarre tropical diseases, etc. And the law did a number of things, including creating the Marine Hospital Service, which was a series of hospitals built and operated by the government to treat these privately employed sailors, paid for by a mandatory tax. Mandatory tax. This is pretty much how it works today in many European nations that conduct specialized medical programs for its citizens. The nation grew, the system was expanded to cover sailors working in private vessels sailing the Mississippi and Ohio rivers. It eventually became the Public Health Service, a government-operated health service that exists to this day under the supervision of the Surgeon General. So, what are going to be the counter-arguments? If you present this to a no Obamacare person, what will they say? What will they say to argue against this, you think?
They'll say that at the time that was what made sense and now it makes no sense.
Okay, but that completely throws out the constitutionality argument because it was the same Constitution. Go ahead, Natan.
Well, I haven't researched this, but based on what you're saying, it seems like this only applied to sailors who worked privately.
Right.
So you could make the argument that no one's forcing you to become a sailor. If you become a sailor, then they're regulating what you need to do to be one legally, which is buy government health insurance.
That's exactly the argument that you would hear.
It is.
Which is correct.
Right, but
maybe.
At the same time, many of the arguments coming from the right are that there should be no mandate at all. So just the concept of it is something that, you know.
I agree. The thing is, I disagree with Natan. That the argument would be, listen, no one's forcing you to become a sailor, and therefore you're not really being forced into buying health care coverage in the way that the Obamacare bill proposes to do. The reality is every one of us has the option to turn down employment that would require us to purchase private health insurance under the health care reform law and fall into a presumed safety net. We all have that option. The question is, would it be practical? Of course not. Just as it would have been impractical for someone looking for employment as a merchant sailor in 1798 to turn down a job then because they were required to purchase health insurance.
Yeah, but that distinction is the key. No, with the current Obama, quote-unquote, Obamacare bill, the problem is that every individual is forced to buy insurance or they pay a penalty. This is not a regulation of people who choose to do something, and then that group that chooses to do something have to do something else according to the law.
What I'm saying is it's a distinction that is false based on, at the time, are people really going to turn down jobs because they need to because they're going to have to buy health insurance? We're talking about a completely different world.
Okay, but it's not coercion in the same sense. That's just saying that it's making people do something out of necessity. But that's different than saying that every person has to buy something outright. And the problem with this bill, which is what's being discussed at the Supreme Court, is whether this is going to set a precedent where then the government can oblige you to do other things.
I think Natan may be missing the point, because one of the main questions we're dealing with now with the current healthcare bill is a penalty for not having health care the same as a tax?
No, that's already been discussed on day one, and it's already been ruled that they're going to decide it now. That's an irrelevant argument.
They're going to decide it now, but it's not irrelevant.
It's already been deemed irrelevant because they've already discussed. So in other words, they talked about that on day one, and they completely pushed it aside on day two.
But that doesn't mean that it's irrelevant. It was part of the 3-day hearing.
The reason why they got to day two is because they rejected that as a basis for not getting to day two. So it's already irrelevant. That's what I'm saying.
Okay, let's get back to the constitutionality for a second.
Okay.
1798. The idea that the government can mandate private industry to purchase health care was perfectly fine with many of the framers of the Constitution. Do we all disagree that this is indicative of that?
No.
Yes.
You disagree with that?
Because you're not understanding the basic. I mean, I said what I thought, and you say, no, it's not the case, but it is the case, which is that no one is forcing you to become a sailor. In this case, people without doing anything are being forced to buy health insurance.
Okay, I understand the distinction, but it is still the
there is
government.
still a government mandate.
Exactly.
There's still this government mandate.
It's an employment mandate. It's an employment for everyone who becomes a sailor.
To pay a tax for health care that the government provides.
But it's only being applied to employees, not to the entire population.
I understand. I don't know that we're going to get any further with this, Louis.
Well, I mean, we have to move on anyway.
We do have to move on.